Age is not a disease. What do you mean by that, Dr. Rhett? That's an excellent question. Let's talk about it.
No, your eyes aren't messing with you. Yes, I trimmed my beard between when I filmed that intro and now. I feel like I went too short though. But I digress. This is a pretty common conversation that I tend to have with the owners of my older patients. It usually happens when they bring their pet in for their annual vaccinations or some other reason, and during a physical exam, I might notice something like horrible periodontal disease. They have terrible plaque and tartar on their teeth, they've got bad gingivitis, they've got horrible breath, sometimes loose teeth, and overall their mouth just looks like something out of a horror movie. And I'll tell them that they really should have a dental cleaning, probably with some tooth extractions in order to make them feel better. And the owner usually comes back with something like, well, yeah, I know they need the procedure, but I'm really afraid to put them under anesthesia because of their age. And I get it. I totally understand. On the surface, the logic seems reasonable. We usually equate older patients with patients that are more frail and maybe can't handle these procedures. And that's whenever it's really important that I put it into perspective for them. You see, the thing is, age is not a disease. Age in and of itself does not inherently increase the risks associated with anesthesia. If your pet's blood work and physical exam are perfectly normal, then their anesthetic risk is about the same as any other healthy younger pet. You also have to consider the fact that the disease process that we're recommending the anesthetic procedure for is probably way more harmful than the risks associated with the anesthesia. We're not just here to get your money and do a whole bunch of procedures. Our mission, our whole goal in life here as doctors is to make sure that our patients have the best possible quality of life for as long as possible. And so you have to consider the fact that when we recommend these procedures, it's because we know that to allow them to continue on with these disease processes, such as horrible periodontal disease, we can actually be decreasing their quality of life and sometimes even shortening their lifespan. Now, I'm using periodontal disease as an example, but that's not the only time that we wind up having these conversations. Sometimes with some of these disease processes, the only diagnostic options that we have is something like an exploratory surgery or an excisional biopsy or some other thing that requires anesthesia. And at that time, we're weighing out the potential benefits and risks associated with that anesthetic procedure. And that's why we do things like preoperative blood work and thorough physical exams. Sometimes we'll do an ECG of the heart. The point is, our overall goal is to make sure that that procedure is as safe as possible. And if your pet has a good physical exam and good blood work, then there's no reason why they can't undergo that anesthetic procedure just as easily or as safely as any other younger patient. I understand that that idea still makes some people nervous, and I hope this video provides just a little bit of context. Just because a patient is old, that doesn't mean that they can't undergo an anesthetic procedure. And of course, we do everything that we can to make it as safe as possible, which is why we do things like preoperative blood work and physical exams. We place IV catheters to make sure that we have as much control as possible in case things do go wrong. And I guess the thing to take away from this is that when we as doctors recommend a particular anesthetic procedure, we are weighing out the potential risks and benefits. I know that can still be a scary concept to some people, and I hope this sheds a little bit of light on the subject. If you have any particular questions about this subject, please feel free to drop them in the comments, and please don't forget to like, share, and subscribe, and we'll see you in the next video.